thing and diagrammatic representation manually over the Jamovie, whereas in JASP, you will see it automatically gives exactly as you will see in the SPSS AMOS. So that's why we, for this whole 3 days or 4 days, we will be doing all the activities on the JASP. Okay. So now coming to the basic concept. So all the reading material that has been shared with you, these PowerPoint and the recording of the lecture, that will also be shared with you. And we have used these 2 books as a reference apart from other article. The first book is the Health Measurement Scale by the David Landsteiner and the Geoffrey R. Norman. And this second book, this is the Scale Development by Robert. So these 2 books we have used as a reference or the guiding document for the all the theoretical part which we will be covering. So you can go and go back and try to go through the pages after we conduct the session. So that will make by this you will understand these concepts more. But still, even if you don't have time, you will just see these lectures, then also I think you will be able to achieve a lot. So yes, basically this scale. So many of you have said that either you have done some work or some work is there in front of you, you have to decide on something, or a project is going on and you have to take lead onto that project. So it's good that you are in a lead role of these studies. And so it has to be a decision maker who will decide now next what to do. So since this is a study, you plan to conduct a study, but many of you are already into this process. So what generally we do, we make some measurement. We do some measurement in any study which we plan to do. So generally we call these measurements as variable. So a variable is a trait which is likely to change or likely to vary from person to person. So if you see one person has got uncountable number of variables, but we only count variable or measure the variable which are of interest to us or which is there in our research question or in our objective. So this variable is ultimately, it is a characteristics which changes from one person to another, and few variables we mention which are of our interest. Like in this case, you can see there's an age of the person, there is a gender or the sex of the person, there is a BMI, there's a blood sugar level, weight of the person. So these variables are there which I want to measure. Now, what is a construct? So basically, during this 4 days workshop, instead of variable, we will be telling this name as construct. So what is a construct? So basically, in research, whenever we do something or whenever we measure something, the broader concepts which cannot be measured directly, they are known as construct. For the construct also, we have different variable to measure because directly we cannot measure the construct. So generally, for in all these scale development, the construct is something which is a very broad concept and which cannot be measured directly. So like few construct to be mentioned here. If you see towards the right side of this slide, so it is the age, gender and weight. But if you focus on the left side, it is the health, quality of life and attitude. So yes, can you differentiate between these 2 categories of construct or variable? What is the difference? Age, gender, weight, or age, sex, and weight, and health, quality of life, and attitude. If you have to measure attitude, haven't you find it difficult in CAP questionnaire when you have to form a question on attitude, how to form the items, how to measure attitude? So yes, it is something which is not directly measured, rather through many variables you measured. Similarly, health. Although the WHO has given the definition of health, but we always say that is a very ambitious goal and you cannot measure health directly. It is through many other questions or items. Similarly, the quality of life. There are many tools for the assessment of quality of life. There's a WHO, there is a SF36 and many more. all those tools are having different item format. So even the quality of life you cannot measure by a single question or by a single measurement. So the construct which are towards the left side, these are the broad concepts and we cannot measure them directly. So to understand the concept of construct and how they are different from variables, just see this slide for a few seconds. So first, focus on this part, socioeconomic status. So if you see this, please focus first on this. So what is this? Socioeconomic status. In this, you can see there are 4 names are there. So in this case, you have to identify which is the variable and which is the construct. Yes, all of you, please type in the chat box. Wealth is a construct, okay. Suryanarayan, Dr. Suryanarayan is writing, yes, good. But Dr. Suryanarayan, in this case, then what is the variable if wealth is a construct? Anuradha Dave is also writing wealth as a construct. Self-esteem is a construct. Self-esteem, yes, good. Dr. Priyanka is right. But self-esteem is towards the left side. I am going one by one. So first you have to see that, yes. So income, education, occupation, that is a variable. True, Aditi, Ayushi, you are right, and SES. So in this case, if you see the socioeconomic status, that is a construct because that is broad. And we are measuring that through the income, education, occupation. Probably wealth is not a right category here. But again, like if you identify wealth by some wealth indices, then you can have this as a variable also. So these income, education, occupation, this is like a variable. And socioeconomic status is a construct. Now coming to the second, which is the self-esteem. So many of you have already said that self-esteem is a construct. And then what about these 3 items? So the first item is, I feel that I'm a person of worth. The second item is, I feel confident in my abilities. And the third item is, I am satisfied with myself. So all these 3 items are what in this context? And what is self-esteem? So self-esteem, I think Priyanka has already said, she's also writing, it is a construct. And all these individual items, 1, 2, 3, here we call them as a variable. Yes, Saurabh is right. So through these 1, 2, 3 items, which are also known as variable, we are measuring the construct, which is self-esteem. So that's the difference between the variable and construct. So basically construct is a broad definition or a concept that remains in our psychological domain. And this items which you can see, number 1, 2, 3, these are the variables. Similarly, if you focus on the dietary quality, so dietary quality is a construct here, and the fruit intake, vegetable intake, saturated fat intake, added sugar, whole grain, that is your different variable. And if you come to this depression, which is a construct, then these are like individual items. I feel sad most of the time. I have lost interest in things I used to enjoy. I have trouble sleeping or sleep too much. So all these 3 items which you are seeing here, they are the variables. So currently I'm not going into the type of measurement scale because again, there is a difference between these 2 type of construct, between the dietary quality and depression. So we'll again come back to this concept when we will go to measurement model. What is the difference between these 2 construct? Because these 2 construct, dietary quality and depression, they are not there is 2 different type of construct. So how they are different, we'll discuss towards the later part of the talk. So basically we use variables to operationalize the construct. Likewise, you see in the dietary quality or in depression or in self-esteem or in socioeconomic status. So all those broad thing were the construct, and the individual item or the individual socioeconomic status under that, income and wealth and education, that was the variable. So this is a question for you people. The question is, a single construct is often measured by multiple variables. Do you agree with this statement? Or a single construct is measured by a single variable. So Dr. Latika is writing right. Ayushi, Aditi, Tandra. Okay. So all of you are right. They are measured by the various variable. So now let's check your understanding. So this is the quality of healthcare services. So this was the, if this is the construct, write few variables for this construct in the chat box. Quality of, like, whenever you go to a doctor, okay, yes. Affordability, true. Accessibility, whether that area or that healthcare facility is accessible to me or not. And rather important for all of us. If there's a huge queue, we will not be liking that particular health facility. Dr. Rai is writing access to medicine, availability of drugs. Yes, quality of care given. How communication, very important. How the doctor is talking, how the nurses are behaving. Sanitation, Dr. Latika is writing. Yes, cleanliness, availability, very important. If the doctor is not, most of the time you will see that that doctor is out of station, or maybe a particular person hasn't come. So the availability of the person, behavior of the healthcare, Priyanka is writing, Sheetal is writing HR, logistic, care given on time. True. So all of you are very right that these are the various variable which you can think whenever you want to have a quality of healthcare services. So, but by seeing all this, now what is a measurement? So we have seen till now that measurement is something where we assign a number to a variable or a construct, because even if you have these items, you like take the responses in a Likert form or in a yes or no. If you like doctor-patient ratio or care given on time, you can also have a Likert item, or again, you can have a like yes and no type of binary item response format. So basically this measurement, in any measurement here in scale development also, you give a number to a particular variable. Why? Because the analysis which we perform, all the reliability and validity studies, that can be done only on numbers. That cannot be done on a something which is a entirely categorical in nature. So this number we generally give, and here also you will give that, say that we give a number to the response format. So yes, all of you, please find out the odd variable in this in the terms of measurement. So pain, yes, height, blood pressure, and SpO2, they are very objective. There is objectivity in the measurement, and pain is the different. What about this? Cleanliness, surgical site infection, surgical gloves use, amount of biomedical waste generated. Yes. What will be the odd in this? Amount, cleanliness, surgical site infection, surgical gloves use. Yes, cleanliness, because amount is you can measure how much. Generally, we weigh also, like how much kg or ton of the biomedical waste is getting generated from a hospital. What about this? Patient satisfaction, depression, burnout among doctors, vitamin D level. Yes, Aditi is writing, Bhumika, Priyanka. Yes, vitamin D, very right, very quick. So what was the rationale of all these three answers? So in this, what you must have thought during the answering process, that something is there which can be measured by an objective tool like vitamin D or blood pressure or weight. And there's another, classification where you cannot measure the thing directly. So you have got some indirect measurement. So can you write few other construct like this in healthcare setting? We have given few. All of you are requested to write a construct. Construct means which you cannot measure directly in healthcare setting. Yes. Perceptions, safety measure. Okay. It can be perception regarding anything. Student satisfaction, very true. Pain of cancer patients, health literacy. Yes. Health literacy, patient satisfaction. True. Quality of life. Yes, very right. Attitude, violence. Yes. Okay. So these are a few other variables in healthcare. Bullying, very true. It has come up now here also. Initially, this concept and burnout. Burnout, yes, we have again written something. Burnout awareness is more of a. It is not a broad concept. Rather, it will be more of a knowledge thing. But again, you can turn it into a construct. Definitely, feedback, patient care, stigma. Yes, stigma. Professional ethics, very true. So these are some very difficult things to measure. Ethics, like stigma, again, it is not very true because there is a various types of stigma, internalized and then, reflective, and all those classification of stigma is there. So these are very broad concepts and they truly fall into the definition of construct in the healthcare. Again, these are some other construct like attitude for blood donation, academic pressure, job satisfaction. And again, Shruti also written something related to student satisfaction from teaching. Like in medical education, there's a lot of construct which you can measure, which like one activity you people will also be doing, that is the empathy in the medical students. So these, like with the advent of this attitude, ethics and communication, that is the ATCOM, by the NMC, you have got a lot of construct which you can measure. Previously also it used to be there, but now we are taking regularly the classes. So now we can do more such activity of measuring something which are more abstract and broad in concept of medical students. So we call them as a intangible variables. Here also you can see tangible and intangible variable. So in this, like it is a AIIMS Delhi, and can you find out few intangible and few tangible variable in this hospital? So I'll go straight, like these are some number of ultrasound machine in the hospital, cleanliness of the hospital, suicidal intent at the workplace. So number of ultrasound machine is a very tangible thing. Even the cleanliness also you can have indicators. But if I have to measure suicidal intent at workplace, that is a definitely an intangible variable. So which is not very easy to measure, and I cannot measure it directly. So a few more in this list is the like tangible, you can see equipment, computers, furnitures, building, garden. But intangible is like, again, I said attitude, ethics, communication, treatment response, anxiety, etc. So we have already defined what are these constructs. But again, to be more specific, these are the abstract concepts that are not directly measurable, but it can be measured indirectly through related variables or through related item responses. So in this, what are the various constructs in this slide? Yes, I'm spending few more minutes on this construct because the basis of this scale development underlies under this definition of construct and variable, because that will tell you whether you can perform a validation studies and reliability studies or not. So yes, patient satisfaction, self-esteem, true. Fatigue, very true. Depression, cleanliness, self-esteem, true. True. You can see that indirectly measurable, age, height, gender, they are directly measurable, and ethnicity, socioeconomic status, quality of life, depression, happiness, anxiety, they are indirectly measured. Yes, Ayushi is writing happiness. So here, when you are measuring a blood pressure, what do you see? Actually, here also you are not directly observing, but since we have something which says that the mercury level tells you indirectly the level of blood pressure. But ideal way is to do it intra-arterial. That will be the true blood pressure. But since we cannot do that, we do it by the taking through the sphygmomanometer. So however accurate an instrument is, however costly, I should not be using the accurate, however costly instrument is, there can be measurement error associated with any of these instruments. And similar measurement error you will find in the scale development also. So Dr. Rupesh is writing, can obesity be a construct since there are many methods to measure it? Yes, you can define it. It is up to you. Generally, obesity, we have many indicators these days. Like you have waist hip ratio, you have got BMI, you have got waist circumference and skin fold thickness and all. But those ultimately see whatever BP, yeah, even the gender. Initially, a variable is a construct is like a construct. But when there are ways to measure it directly, then it becomes a variable. A construct remains something which is indirect. It is as a broader idea. So obesity, generally we call it as a variable because we can measure it directly and it is tangible. But something which you cannot see, you cannot measure directly, that we more call it as a construct. There is a, like many textbook, they say that construct and variable are same. But we for this purpose of workshop and for doing the research and teaching also, we generally delineate between these two. So variable is more of a, we call the name as a tangible, and construct is more as an intangible. And the items basically which you have to measure this construct, you might call them variable. So variable term is also there in the construct, but construct per se is a very broad thing. Remember, you have seen those items in the job satisfaction or in the attitude or in any other scale. So those items will act as a variable to measure the broad concept of that. We call it as a construct. So this is the definition between the difference between the construct and the but generally obesity, if you ask me, I will call obesity as a construct. Yes, a broad construct, because the other measure which you are seeing, there are the different methods, but basically everything is measuring your fat, whether you are doing the BMI, means excess weight, or the waist circumference. So basically it is measuring your excess weight or your excess fat. It is not the amalgamation of various indicator. So you cannot call it as a formative. We'll learn these things, the difference between these two. So for me, I can say that variable obesity, you can call it as a construct, and there are various variable like waist hip ratio or BMI. They are the other variables which are measuring the obesity as a construct. So now coming to this, the blood pressure is Dr. Shruti is writing, maybe construct can be defined by multiple variables only. Yes, true, because a construct is broad. So you cannot have only single criteria to make a construct, because if you can measure it by single criteria like blood pressure, you will not call it as a construct, rather you will call it as a variable. So to be more to keep things simple, that the measurement which you can do only by one question or by one item, you call it as a variable, and when you have an amalgamation of these, you call it as a construct. So blood pressure, it is an unobservable variable, and mercury height is a observable variable, but it is very closely correspond to this, so that's why we call it as a variable. Now these are some statement. If you write like this is the definition of some broader concept or construct. So if I ask you like the painless killing of a patient suffering from a incurable and painful disease or in an irreversible coma, so what we can call it as? Yes, you all are right. Shruti, sorry, Selva Raju has written, Shruti is also written euthanasia. And then the next is the formal union of a man and a woman typically recognized by law, by which they become husband and wife. So this is what? Marriage. So this is just, we have taken the statement, the definition. So these are like marriage. If somebody asks you, define marriage, how will you like define it? So Dr. Mahima has raised her hand. Dr. Mahima.
Sorry, ma'am, it was by mistake actually. I was about to write that. Yes.
Okay. It's okay. So this is the marriage. So this is the theoretical definition. So we will learn in the process of scale development that you have to define your construct. So these are some definition of these construct. So we often refer these construct as mental abstractions because they are never directly observable. That's we have seen. So in this case, if someone asks, and again, there is another difference between a variable and a construct. So if someone asks your age and gender, will it be difficult for you to answer? So yes, the answer will be no, because you can definitely tell your age and you can definitely tell your gender. But if I ask, because these variables are linked to the unambiguous characteristics and we are very tuned to it. But if you can recall, if when your kids are very small kids, they don't understand the difference between male and female because they are just learning. But through repeated exposure, they learn who is a male and who is a female. So these are just examples that initially everything is like a construct, a very broad thing. And once you start measuring it, once you start paying attention towards it, then you understand, okay, see, this is male and this is female, seeing the morphology or even that is the date of birth. And but if someone asks about the ethnicity, so a single question will be difficult to answer this ethnicity. So whenever you take time to respond to a question, and that response will be a bit more complex than the earlier response, and it will be a like combination of your physical, cultural, and your historical factors. So taking time in giving response, and when it creates some psychological impact on you whenever you see that those questions, those are the items which are basically trying to indirectly measure your construct. But if I ask this girl regarding this girl is suffering, it's a post surgical and post radiotherapy case of cancer. So if I ask from her regarding the quality of life, then I need multiple questions to assess the quality of life. I cannot ask a single question like what is your age, and I cannot judge that. So like quality of life, there are many other theoretical variables like depression, poverty, attitude, anxiety, and scale contain basically multiple items which are used to measure such complex variable. So we use concept and variable interchangeably, but now you know what is a construct and what is a variable. So construct are basically conceptualized at the theoretical plane, means abstract. They are abstract and they are in your psychological domain, whereas the variables are operationalized and they are measured at the empirical plane, means at the level of observation, whenever you are observing this thing. And you will see that there will always be a gap between two, because whatever variable you will generate, that is never going to measure it as accurately as they are. And that is known as the measurement error. So we will learn the concept of measurement error tomorrow. Whenever you measure something, whether it is a socioeconomic scale or it is an anxiety or it is a self-esteem, so you are measuring it through a plane which is an observational plane. And the construct, they are operationalized or they are conceptualized at the abstract plane. So there will be a difference between these two, and we call it as an error. And that we will see in the measurement model. So like intelligence, we have defined intelligence as IQ score, weight as in weight in kg, and depression as BDI score or DAS score. So we need to observe few relevant items to measure the abstract variable. Generally, we observe it indirectly through self-report or we administer. In this case, for example, you can see the abstract variable of interest if you ask the spouse love. And the question which I have framed, how many times your partner hugs you in a day? So this is a which type of measurement? So you can count it, like number of hugs, maybe one or two. So it is a direct type of measurement. For depression, if I am asking this question, how many times you feel headache in a month? So it is again in a month or maybe in 1 week. Again, it is a direct question because I can answer this that I have 2 episodes of headache or I have 3 episodes of headache. But if I ask this question, rate your anxiety level on a 10-point scale, I cannot answer it directly. I'll have to think like my anxiety level is 3 or 4 or 5, something like that. I cannot answer it immediately. So it is an indirect question. So these examples are just to make you aware regarding the what is a direct question and what is an indirect question. And generally in scale development, we never ask direct questions. We ask indirect questions. Well, that we'll see. Coming to hospital cleanliness, if I'm asking this question, number of dustbin, again, it is a direct question. But if I'm asking this question, rate your satisfaction level on a 5-point scale, it is a indirect question. So can you think of any other variable which we can measure by a single observation? Can you? So no, it is not possible because we need multiple variables or the multiple items depending on the nature of the abstract concept or the construct. Like the initial WHO QL, it has got 100 questions. And now it got briefed, and then WHO QL Bref has 26 questions. So you may have item ranging from 10 to 100, or it may be as small as 4 items also. But generally, you cannot measure it with one item or one rather variable, because item and variable, they are same in context of the scale measurement and development. So it may be possible that the different items, or whatever the concept or the abstract concept you have defined, they are measuring the different domain of the abstract variable. As for example, let's first take the example of this love. So love is again abstract concept. If you cannot ask how much you love me, it cannot be quantified, like how much you love me. So love is a very broad or generalized concept. So that's why I have written it as a generalized. And there are domain of this love, means it is more of a contextual. So caring for someone is also a love. Respect towards your partner or spouse is also a love. Faith or being faithful towards your partner is also love. So love here is a generalized concept, and these care, respect, and faith, they are the contextual construct or the factor of this broad concept. Similarly, if you see depression, depression is a generalized concept or generalized construct, and then the depression in the daily activities or depression in the professional life, again, they are contextual. Similarly, the hospital cleanliness, if I talk about hospital cleanliness, that's a broad concept. And if you break it into small part, like staff attitude, biomedical waste management, staff training, these are the contextual. So this is the difference between a broad concept is generally broken down into a smaller contextual part or domain. So now coming to measurement, what is a multi-item measure and what is a scale? Many times we use a multi-item measure and we call it as a scale. So let's understand this concept, because this is very, very, very important to differentiate between the multi-item measure and scale. Now look at this example. So towards the left side, this is the variable. So the variables are: what is your age, what is your gender, occupation, classification, religion, and residence. And the responses you can see. So can you give a common heading for all these variables? Demographic profile, socio-demographic profile. Very right, very right. Now, can you see this? This is again this is regarding a baby, newborn baby, skin color of the newborn baby, pulse of the baby, grimace, activity or the muscle tone, and respiration. So APGAR, very true. So in both these two examples, what you have seen, that there are variables or items, but they are not correlated to each other. They are not the result of one thing, but we have grouped these variables. So we have taken various different variables like skin color, pulse, ability, muscle tone. We have clubbed them together and make one scale, or it is rather, I should not be calling it as a scale. I call it like, we call it as a socio-demographic scale, but actually it is a multi-item measure. This is again socio-demographic scale. We call it as a scale, but this is not a scale in true sense. This is a multi-item measure. So in multi-item measure, what is there? That all these items, they are not related to each other. Occupation, classification, religion is not related to the residence. Religion is not related to the occupation. It is not related to age. So all these multi-item measure, these are not related to each other. Similar in case of APGAR score. So in all these two examples, what we have seen, that we have grouped the different variables or items under one common category. But this does not imply that there is a causal linkage. I cannot say that there is a causality. So that's why, and these are also not getting reflected, means I cannot say if the socioeconomic status is high, the education is going to be high, because there are various parameters, and there can be a person if he is scoring high on another parameter and low on one, still he can be of a high socioeconomic status. So in multi-item measure, there is no linkage between the questions and the construct which we are measuring. So that's why these are called as the index. We call them as an index, and this is known as the emergent variable. So a more general term for the collection of items, that is just the aggregation into a composite score, is a emergent variable. Have you understood this emergent variable or a multi-item measure? Like in one of the workshop, there was a participant who was measuring the how the person, I think he was from pharmacology, and he was trying to develop a scale which was measuring the insulin knowledge attitude regarding the insulin upkeep and use of insulin at the correct temperature, and probably all other pharmacological measure. So he was measuring that insulin related, all the behavior related to insulin only. So the questions which was there in his questions, that was more of a multi-item. So we cannot call it as a scale if it is just a aggregation of a multi-item, and this is known as the emergent variable. So have you all understood up till this point? Then I'll move further, because it is very important for all of you to understand the difference between a multi-item measure and a scale. And one very important, that there will be no correlation. Okay, so Dr. S.S. Rai is writing, he has not understood. So maybe, let's say I have not written it as Human Development Index. Okay, have you all heard of Human Development Index or Sullivan's Index, all PSM people? Physical Quality of Life Index, PQLI. Have you heard of these terms? Yes. So these are, you will see that there's a name. So we cannot call it as a scale. You cannot call Human Developmental Index or Poverty Index or Human Poverty Index as a scale. It is just what is there. There is an aggregation of variables which are unrelated to each other. Like you call it as a life expectancy at birth or life expectancy at age 1. The other item is the literacy status. The third item is probably the income. So all these, they are not related to each other, but we have clubbed them together to measure something. So that is known as the emergent variable. Yes, Dr. Anuradha, they are the emergent variable or index we can call. We cannot call it as a scale. They are not the scale per se, because each of the item, they are not correlated with each other. You will not find that life expectancy at age 1, it is not really anyhow correlated with the education of the person. Again, Dr. Selva Raju is asking, APGAR is a scale. No, APGAR is not a scale, because if you see, they are not related to each other. They are measuring neonatal distress, definitely. But we have taken some important parameter who is indirectly measuring neonatal distress, but we cannot call it as a scale. Generally, we don't. This is definitely again, I will tell you that measurement scale is of two types. We will see this later as a reflective and as a formative. So if you want to be, I should not be saying these, basically we say it as an index or emergent variable. If you want to use the term scale, you can call it as a formative scale. Formative we'll see later, because you are taking the variables which are unrelated to each other, and you are just making a clubbing of these variables at one point of time, like together, and then you are making one index. So that's why these generally such type of scale, we don't do the reliability and validity studies. Are you okay up till this point? Dr. S.S. Rai?
Yes, ma'am. Okay.
Do you want me to repeat, or you have some query? Then I may repeat it also.
No, ma'am, it is understood, ma'am.
Means any variable which are not related to each other, we have just clubbed them for the purpose of defining another construct like socioeconomic status, or the human development index, or human poverty index, or physical quality of life index, or pardon? Okay, like you, in this case, you have written neonatal distress. So they are multiple unrelated. So Shruti has written, like when multiple construct item, yeah, multi-item measure, and then they are not related to each other. That is very important. Catch in this that they should not be related to each other. And if you like do the study, so reliability and validity studies are not done. Okay. Reliability and validity studies we'll see later. It is such type when there is an emergent variable, we will not be doing the reliability and validity studies. And Dr. Om Prakash is writing what is the difference between a score and a scale. So basically a scale has got various items, and you take the responses from the person, and when you add up to those responses, it makes a score. It will be you will get clarity on this when we go during the later part of the workshop. So don't worry, Dr. Om Prakash, it will be very clear. But up now, if you ask me if there are 4 items, let's say I'll go back. If I ask this question, are you satisfied on a Likert item? If you say that how much satisfied you are with your current maybe work profile, and then you can write like in a point of 5-point Likert scale, so that individuals you score, you will a lot. And then if you add up all those scores, like there will be many items, you add those scores. So addition of an individual item in a scale is known as the score. And scale is the formulation, or it is the, at one place you have got many items. So together, all those items measuring a single construct is known as the scale. So I hope you have understood this emergent variable. Now look into these sentences or the questions or items. Yes. If my variable item or question is, I feel sad and low, and maybe my my response is most of the time. The second is, I feel disinterested in things that earlier seems pleasurable, and my response is some of the time. The third question is, I feel I should be punished. Again, my response is some of the time. I feel guilty. I have difficulty in making decisions. So these are my responses. So yes, Dr. Selvaraju, who have asked this question like the scale and score. So this will be like measured in a score. So these items are measuring the depression. So this is, maybe you can name it as a, maybe you can call it as like Beck depression inventory. So that will be a scale. And then the next is like, these are the items format and the response. So maybe you can call it as a 4 plus 3. Maybe I have not written like what is the number which I have given to most of the time and some of the time. But let's say if I have given this as a 4 and this as a 3 and this as a 3. So 4 plus 3 plus 3 and then again 4, 4. So total of 12 and this as 6. 18 will be score on this scale. So have you understood the difference between score and scale? So can you anticipate what these items should measure? So again, you have written correctly that it is the depression. So in this example, what you can see that these are the result of one construct. Result of one construct means there is a causal linkage between the question and construct you are measuring. And this is a type of theoretical construct. So now again, I have introduced one term here, which is a theoretical. So what is a theoretical construct and what is a theoretical construct? So basically, what is a theory? So theory is an idea or a set of ideas that tries to explain some phenomena. Like in physics, there is a Big Bang theory. There's a theory of relativity. In biology, there is a cell theory. There is a Mendelian theory. Through that theory, you can explain one phenomena. Similarly, in chemistry, there is a kinetic theory, valence bond theory. So coming to various theoretical framework, we have got various theoretical framework. Like there are many psychological theory, there are social theories, there are organizational theories, there are economic theories. So basically for us, it is mostly the psychological theory and social theories who are important. For people in management, they do more of research on organizational theories and economic theories. So now coming to theoretical and atheoretical measure. So if I ask this question again, we have asked this question earlier also. What will you do to know the age and sex of a person? You will simply ask the question. So is there any theoretical framework behind these questions? Yes? Can you write yes or no? No. Yes, Swapnil is writing no. Shruti? Yes, no, there is no theoretical framework. Now again, look into these two group of constructs. So you can find one towards the left, self-efficacy and health belief model. So do you find any theories behind these? Self-efficacy, health belief model? Yes. So left will have theory, health belief model. Many of you who are from the community medicine background, you know about the health belief theory or health belief model. Like I have some perception regarding my disease. So if I perceive that it is not severe, I will not go for consultancy, or there is a delay in health seeking behavior. So this health belief model explains a lot of behavior towards health which people exhibit. Similarly, self-efficacy, measurement of self-efficacy. Again, it is a construct which is a theoretical construct. Coming to towards the right side, which is the BMI, cholesterol, hospital readmission rate, if you see this whole, then you will see that these are not the theoretical, rather they are atheoretical. BMI you can measure directly. There is no theoretical background in measuring of a BMI, cholesterol, hospital admission rate, etc. So now again, the assessment of hospital patients for meal preferences. Is there any theoretical framework behind this question? Yes? No. Yes, very right. If you want to take public opinion on whom they vote, like if there is an election, there's an exit poll, and you go and just ask, okay, so whom they vote, if you see, yes, there is some theory going on, but if you ask this question, this is a direct measurement. Now coming to this, if you want to take public opinion on how attitudes towards a specific issue, like employment, it affects the candidate preference. If you ask this question, like on the particular issue of employment, how the candidate or how the people, they are selecting a candidate whom they vote. This is more of a theoretical construct. So now coming to the measurement model. Now I will explain this very clearly. Till now, I will just revise or summarize what we learned. So we have seen that there is a variable and there is a construct. What is the difference between a variable and a construct? We have understood that construct is a broad concept and construct is something which is there in our psychological domain, which cannot be measured directly, which cannot be seen directly. So a construct is measured through many items, and that items are directly observable. Coming to the types of construct, we have seen there are two types of construct. There is a theoretical construct and there is a atheoretical construct. A theoretical construct is something which can be explained by various theories like psychological theory, health theory, sociological theory, and the atheoretical one which has got no theoretical background in it. So that is a atheoretical variable like measuring cholesterol or maybe measuring the other thing like education. There is no theoretical construct behind measuring education. Again, I have introduced a term, something known as the index or emergent variable. When you club unrelated variables together to make a composite index. There also you have got many variables, but you have just clubbed them together to make a composite index. That is known as the emergent variable. And generally the reliability and validity studies are not done on the emergent variable. So this construct, what is a construct? Construct is an abstract idea which exists in our mind, and we measure construct with the help of item. So which comes first? This is very important because the whole analysis of the reliability and validity studies depends on the understanding of this construct and item. So which comes first, construct or item? So Swapnil is writing construct, Selvaraju is writing construct, Dr. Suryanarayan construct, true. Because construct is there in our mind. It is a psychological domain. That's why you call it as a psychometrics. So it is there in our mind. But the problem is we don't know how to measure. And that's why we devise items. Items, it will come later. So construct is there. Since like our birth, you can say, and we learn these construct through various exposure, through our family, through society, through social media. The construct is there in our brain. It is there in our psychological domain. And to measure that, we devise item. Now, first focus on the first thing. You can see there are two diagrams here. The first one. So we are learning the measurement. There are two types of measurement model. So in the first measurement model, there is a construct which is there in our psychological domain, and we have devised item to measure that construct. So basically the construct is affecting the item. Like you can recall that depression. So depression is a construct, and if I write that I am feeling low most of the time, this is an item. So construct is affecting the item. Remember, construct is affecting the item. So the direction of arrow is from construct to item. So in this case, if you can recall if those of you who know or who have a background of the logistic and linear regression, in this case, which variable we call it as a dependent and which variable we call it as independent? Yes? You have to write because that will tell you the basis of all factor analysis. And item as a dependent. Yes, item as dependent and construct independent. Very right. So please remember this, because ultimately there's a lot of confusion. You think that you are measuring depression through item. So you always think initially that my depression is a dependent and item is an independent. Are you thinking? Are you getting me? If you are measuring depression, if you are not thinking, then inadvertently you might say that depression is a dependent variable because you are measuring depression. But this is not the case, because depression is a construct which is there in the beginning, which is there since, it is there in our psychological domain, and through this item we are measuring the depression. So this construct is affecting the item. So that's why you will say that item is a dependent and construct is an independent. Remember, depression is independent and the item, like I feel low most of the time, that is my dependent. So please remember this. So now coming to the second type. If I go to the second type of model, here the item affects the construct. So like in case of socioeconomic status, if my education is high, item is like my education. If my education is high, if my literacy is if my earning or the income is high, if my occupation is high, then my socioeconomic status will be high. So here the item is affecting the construct. Okay. So it is again one type of measurement model. So the first type is known as the reflective model. So this is known as the reflective model. And the second type is known as the formative model. So now you have to answer this question all those emergent variable which we have seen, like you have seen socioeconomic status, I told you the name of human poverty index, the developmental index, and you have seen the dietary choices or dietary quality intake. So all these variables or the like measurement scale, you can say, or the variables or the what we call them, which type of measurement are those? A reflective model or a formative model? So Priyanka is writing formative, Parvati, Bhumika. Yes. So you are right. Those are the formative. And the depression, job satisfaction, quality of life, or maybe the empathy, or maybe the attitude. What is that? Which type of measurement? Yes, reflective. So all these reliability and validity studies, they can only be performed on a reflective type of model. We cannot perform a reliability and a validity studies on the formative type of model. Am I making sense to all of you? So till now, have you understood the two types of measurement, the two types of construct? So basically, a theoretical construct will always be on a reflective model, and an atheoretical construct will always be on a formative model. Both are measurement, but one is on the reflective and other is on the formative. So to perform the reliability and validity studies, we generally go with the reflective model. We'll talk of formative a little bit and the type of analysis we do for the formative model. So you will see later part that there is a exploratory factor analysis and there is a principal component analysis. So basically the principal component, we go for this formative type of model, and the factor analysis, that is the exploratory and confirmatory factor analysis, we perform those analysis on a reflective type of model. So Dr. Anuradha is okay. So repeat the last part. I'll again repeat it since beginning. So we have seen here, first let's focus on this one, latent. This is the latent variable. Let's say this is one construct, and this construct is affecting item. So item, let's say it is like, I gave just example that I feel low most of the time. So this is one of the item, and the construct is depression. So here I was explaining that since the construct is there before the item, you have devised these items later on. The construct is there before item. And these construct, for example, depression, that is affecting the item. So construct is a independent variable here, and item is a dependent variable. Any change in the depression will affect the item score. It is not that change in the item score will affect depression. Depression is not getting affected by the item score. Rather, item score is getting affected by the depression. If I am having high depression, my score will be high. If I am having low or less depression, my score will be low. Although we say that if I am having high score, my depression is high, we diagnose it other way around. Because how do you do that? You give PHQ 9 to one person, you calculate the score, and you say that whether this person is having depression or not. So, or the Beck depression inventory, you calculate the score and diagnose it. But you cannot say that because of high score, this person is having high depression. No, because of high depression, we say that this person has scored more. So that's why here the depression is affecting the item. So this type of scale or measurement model is known as the reflective type of model. Means the item is a reflection of whatever is happening inside. The second type of model is the formative model, where you club all those items together and the item affect the construct. For example, if I took the name of human developmental index, if the life expectancy is less, definitely my construct will be affected. My human development index will go down. So my item is affecting the construct. So that is which type of measurement model? That is the formative type of measurement model, where this arrow, which you can see here, this arrow is from the item to construct. So Dr. Anuradha, am I making myself clear to you now or to everyone? Okay, anybody else who needs a repetition or maybe who have not understood? We will repeat this many, many times. We'll see them. Because, so this is the, now let's see this diagram once again. So this is the job satisfaction. So they are the individual items. So yes, can someone read these items for me? I can see Dr. Latika. Dr. Latika, can you read these items?
Yes, ma'am. So in job satisfaction, we have, I feel comfortable in my workplace. The workplace facilities meet my needs. I have a good relationship with my colleagues. I am satisfied with my job responsibilities. I feel that my work is meaningful. I'm happy with the level of autonomy I have in my job.
So yes, thank you, Latika. So this is a job satisfaction. So this is the which type of construct? Theoretical or atheoretical?
Theoretical.
Yes, very right. And what are these? Like what just you have read, like these various, these 1, 2, 3, what are these?
They are the items, but
Very true. So
here,
now any other person I would like to respond. Then what, if it is a theoretical construct, how should I put whether this job satisfaction will affect these items or my item will affect job satisfaction?
Item will affect job satisfaction.
Okay, Dr. Saurabh is saying item will affect the job satisfaction.
Formative model.
Pardon?
Formative model, man. Formative model.
Formative model. Okay. But if it is a atheoretical, first you said what it is theoretical or atheoretical?
Theoretical.
Theoretical. So in theoretical, what is there? What comes first? Construct or item?
Construct.
Construct. So if construct come first, which is the dependent and which is like a direction of the arrow will be from item to job or from job to item?
Job to item.
Two items.
Yes. Dr. Sheetal is right. It will be from job to item. Why? Because this is the theoretical construct. Job satisfaction is something abstract. And we are trying to measure it through these items. So we have generated these items. Definitely, we are measuring this. They are the direct measurement tool for us. But ultimately, they are getting affected by the job satisfaction. So job satisfaction is a type of theoretical construct. So it is affecting all the item. So it is a which type of model? It is a reflective model. Now, let's take one item from the previous slide. So this one, I feel comfortable in my workplace. Okay, this is one item. So do you think that answer to this question is influenced only by the construct job satisfaction, or there could be some other construct also that could contribute to this response? Like you can see, there are 3 options for you. If I ask this question from all of you, that, I mean, I feel comfortable in my workplace, and you have to give response from highly agree to highly disagree. Okay. So on that Likert item, if you answer this question, maybe highly agree. If you ask this question from me, I will say, yes, I highly agree with this statement. So is it related only to the job satisfaction or some other many more domains like interpersonal relationship? Maybe if I've got good relationship with my colleague, or workplace culture, if the culture here at AIIMS is very good, maybe, or stress anxiety level, if it is less or more. Yes. So there are multiple aspects involved in it. Very true. All of you are right. So any domain like job satisfaction. These are the very broad domain. And it has got some subdomains also. And that those items which you select, there can be some other construct which are affecting that particular item. Okay. So I feel comfortable at my workplace. This item might get affected by the job satisfaction, by the workplace culture, by the interpersonal relationship, and by the stress and anxiety level. All four factors might affect this item, which is the I feel comfortable in my workplace. So Dr. Om Prakash is writing everything sounds the same. I didn't get you, Dr. Om Prakash. Sounds the same means like item are all same, or like domain are all same?
Looks domains or looks like same, ma'am. Like even like job satisfaction, workplace culture, interpersonal relationships, stress and anxiety levels. You mean to say that comfortable status of the workplace depends on 4 different domains? That's what you are trying to say, ma'am?
Yeah, actually, I just want to say like there is a one broad job satisfaction. If you ask, if I have to measure something, even if I devise items, how do you devise items basically? You take the expert review, you do the in-depth interview of all people who are doing the job, and then the items which they say, you formulate it in the form of the item and you then test. But ultimately, whenever we are testing, there are other psychological domain also that is getting involved in the job. So job satisfaction, yes, it will be, these are some minor, you can call it as a sub factor of this also, like workplace culture, interpersonal relationship. This is a broad part, and this is a, probably you can say they are the sub part of it. They can be sub part of it, or they can be entirely new construct, like maybe the stress and anxiety level.
If I'm right, like these 4 are 4 different construct based on this the integral part of this item, correct, ma'am?
Yes, the 4 different construct. Maybe, I don't know. I'm just, maybe there can be. Again, you have to see, because we will see in the factor analysis regarding the explained and unexplained variance. So for that, I am just telling you a little theory. We will do it more when we perform the analysis. But any item which gets affected by the construct, the 100% variation in that item cannot be explained that by particular construct. Means,
Yeah, now I understood, ma'am.
I feel comfortable in my workplace, the 100, like most of the change in this score will not be affected only by the job satisfaction, but there might be another this construct also, like workplace. Maybe you can write like boss, how is the boss, or maybe some other this thing also. A few things I have written here. So that I mean by the item, how an item is getting affected by a construct. So like I have written here, but an item maybe it may get affected by any other construct also. So can we say here that this question that I feel comfortable in my workplace, can we say that only a part of variability of this item is explained by job satisfaction? That item, this particular item, I feel comfortable in my workplace. If I highly agree,
Yes.
can I say that only a part of variability, change in score in this item will be reflected by job satisfaction? Can I say that? Yes. So all of you have written yes. So that's why you will see that with all these items, I have attached a term which is the error term. Can you see? E1, E2, from E1 to E6. Okay, can you see this? And then, but now what about the direction? Can you see the direction is reverse in this case? No, it is also towards the error, towards the item. Means there is an error. Means, what do I mean by this error? That change in this item score is not only getting affected by the job satisfaction, but there might be some other construct also. Similarly, the workplace facility meet my needs. This item will not only get reflected or getting affected by job satisfaction, but there might be any other construct which might affect this. So, so the change in score of this item will not be 100% by the job satisfaction. Similar with all other items. So there will be an error term with all these items. All these errors, but errors are unique. We always call this change is common to all items. Can you see that from this arrow are emerging to all the item? So this job satisfaction is common to all item. But if you focus on this error is unique to each item. That's why we call it as E1 for first item, E2 for second item, and so on till E6. But if you see this is common for all these items. So have you understood up till this point? Then I'll go ahead. Otherwise, I'll repeat this once again. Madam, error concept not understood. Okay. So if you want to understand the error concept, again, go back to that slide, this one. I was telling you that I feel comfortable in my workplace. This item will get changed even if I have got a bad interpersonal relationship. It can be there. Okay. If the workplace culture is not like I am taking this interpersonal relationship as another construct. Because in psychiatry, there is a domain of interpersonal relationship also. So if my interpersonal relationship, if I am low on that domain, then also this item will get affected. My job satisfaction, this job satisfaction can affect this item, but this interpersonal relationship will also affect this item. So I will score low score or change in score of this particular item is not the only change in score of this item is not only due to the job satisfaction, but it might be due to the interpersonal relationship, another construct, or workplace culture, another construct, or stress and anxiety level, my individual stress and anxiety level. I may be a person who get anxious very soon. And if I say I answer this question as probably I disagree. So can you say that this job satisfaction is less? No, because my personal trait is there that I usually remain anxious and stressful. So again, it will affect this item. So one item, the change in score is not get affected only by one domain, but there are other constructs also. Confounder, generally in this case, we don't use the confounder. We call it as a moderator variable. Okay. Although we are not taking it, but if you go to the structural equation modeling, these construct, they are acting as a moderator variable. So you can form a relationship, how the stress and anxiety level is affecting this job satisfaction and together with this item. Okay. So yes, we can call it as a moderator variable or moderator construct rather. Okay. Again, one person is writing, is the error subjective? Because it will depend heavily on how the person being asked this question is feeling through that moment. Yes, but generally, whenever you give the question to one person, have you ever attempted answering such questions? Yes, not this, but any other. Because you will see that, yes, you receive many such questions on Google Form. So how's your experience whenever you attempt such questions? Yes, any one of you? Can you share your experience? Anyone? Or I think any resident can share from AIIMS Patna group. If you like, you people administer, especially during the COVID time, many of you. Okay. So if you don't want to share, maybe let me share. So whenever I receive something, so initially Okay, if the Ayushi is writing the question is lengthening, then we may feel tired while answering. Yes. And many times what you do, you don't even see the responses and just you try to write like 333 mid answer, where you are neither answering right or wrong, or you go randomly. Just you are in a hurry to finish the questionnaire. Many times, and like what he said, like it depends on the status, mental status of the person. So yes, yeah, very true. We usually you try to stay neutral, and this time frame is mentioned. So how did you feel? Yeah, true. I agree here. I have not mentioned, that is just a general question I have taken. So yes, the item will be specific one, like in past 2 weeks or in past 1 week or maybe 1 month. That is very much true, that we should have given a time frame. So the basic thing is, like whenever you administer such question, you expect that the person is relaxed, and you should not. That's why it is very important regarding the data. How that's why you check the reliability of the score. If the reliability of your scale in which the population which you have collected, it is not good, then you cannot go further. So reliability is only to suggest that whether the responses which you have got. So you will check for all these, the neutrality of the person or the mental status whenever he has answered, because then there will be inconsistency, there will be measurement error, and that's what we call those error as measurement error. If the questionnaire is lengthy, if the participants are not reading, then the responses which you will get, you will, if you put that Cronbach alpha, it will not be reliable one. There will be no correlation between the items that you can test statistically. Okay. So right now our aim is to understand that if there is a variability in the item, that is not in this one item, it is not necessary that it is only due to the job satisfaction, but it is due to the other item, other domain also, like interpersonal relationship, stress and anxiety level. And that's how this item or each item, it has got a shared part of this job satisfaction and a unique part of this error, which might be affected by any other domain. That's why 100% means it, the change in this item, the first one, you cannot explain this change only by the change in job satisfaction. Is it clear? I can only see Latika and Shruti to say yes. Dr. Suryanarayan, okay. Dr. Anuradha is also writing yes. So again, to summarize, one item, like let's say, I am happy with the level of autonomy I have in my job. So if you take this question, it can also be affected by the job satisfaction, or there might be another item, like maybe if my happiness index is high, or if like my self-efficacy is high, then also I might that might affect. If my self-efficacy is high, this might affect this item, that I am happy with the level of my job. This one. So just to summarize, any item in a scale, it gets affected by the underlying construct, and then it has got a unique error term associated with it. That means it gets affected by any other, it might get affected by any other domain also. And that's the unique error term which is associated with it. So error term is unique to all items, but this construct is common to all. So that's the concept of shared variance. So we will introduce a term variance later part of the workshop. What is a variance? And this whole analysis of this validity and reliability studies is based on this variance concept. So now this is again a same, you will find this diagram in most of the textbook, that this is a reflective model. And you can see here that this is a principal factor one. So factor, the various domain of a broad construct are known as factor. So this is factor 1 and this is factor 2. You can say this y1, y2, y3. So y1 to y6, it is this whole is a 6 items. And these are the error term, error 1 to error 6. And this is the direction of the arrow. So these items are getting reflected by the getting affected by this principal factor 1, all these 3, and this y4 to y6 by the principal factor 2. So the direction of causality is from the construct to measure, and this is known as the typical reflective model. So this, you can say that the measurement error is at the item level. And there will be high correlation between these 3 items. So item will be highly correlated. So what I said, in a reflective model, the items are highly correlated with each other. Okay. But and again, how we can write the relationship between the item and factor? So now from a theoretical construct, we are starting a little bit of statistical concept. So this xi, what is this xi? Xi is the observed value of this item. So this item, which we have discussed, I feel comfortable in my workplace. Just take example of this and think that I am measuring that item. So xi is, if you see this xi is the score of a particular score of that particular item. Okay. What is this lambda I? This lambda I is the factor loading. We'll see this in the factor analysis, but this is the factor loading, which is representing the strength and direction of relationship. It is a linear equation. Can you recall the linear regression? How we write a linear regression equation? Y is equal to ax plus b.
ऍक्च्युली माझ्या मला वाटलं तुला इथले 2 वाजेपर्यंत हे होईल. चला.
Okay. So this, can you recall the linear equation model? So can you see that this is y is equal to ax plus b, where b was the error, a was the coefficient, and this x was the independent variable, and this f is a independent, and this x is a dependent variable. So what is x here? X here is the item. Remember, we call item as a dependent variable. So x is the observed score value of item. F is the factor, like job satisfaction. And this is an error term. Error term means that unique error which is associated with each of the item. And this lambda I is the factor loading. Actually, it is a coefficient. So it is a factor loading which tells you the direction and strength of relationship. Okay. And this F is the underlying factor that is affecting this X. So have you understood this simple equation? How that reflective construct, we convert this into a statistical thing. She's writing yes. So I hope you have understood. So I'll go ahead now. Similarly, how you can write the equation? So for this item of I feel comfortable in my job satisfaction, this lambda will be my loading. This job satisfaction is my factor, and this will be my error. Again, the same thing. This equation, I have just replaced this xi with this question. I feel comfortable. So score on this question will be equal to this loading and this factor plus error. Okay. Because you know that this job satisfaction, this is affecting this item, and the error is unique to this. Have you understood up till this fine? So Dr. Om Prakash is writing how to find the value of substitute. You will get it from the factor analysis. This is just, we are explaining the theoretical part. Once you do the exploratory factor analysis, everything you get in the software. You don't need to take the value, but you need to understand the concept behind it. Otherwise, you will not be able to write the interpretation. Because most important part with these scale development and validation is the interpretation. Software handling is very easy. You give the command and you will get all these values. Okay. So now this is another diagram which is the formative. So you can see the income level, wealth, employment status, educational attainment, social network, access to information. I have clubbed these variables together to form this socioeconomic status. So the direction of arrow will be from this item to the socioeconomic status. The way we, it's just the reverse. So the direction will be like this, and you can see that this error term, if you see the error term is associated with this variable. In case of a reflective model, where you saw the error term was there at each variable. Remember, each item, error was there with each item. Here the error is there with this particular overall emergent variable. So now, if you see this, a typical formative model looks like that. There are item Y1 to Y6. There is a composite factor 1. Y1, Y2, Y3 makes composite factor 1. Y4, Y5, Y6 make composite factor 2. The error term is there with the individual factor, and the direction of causality is from the measure to construct. So here the measurement error is at the level of construct, and this is a formative model. And if you see these, so in case of a reflective, the Y1, Y5, Y4, Y5, and Y6 were highly correlated. But here they will not be correlated. So items are not highly correlated. So the relationship, how you can write the relationship here? This F is your factor. This will be your socioeconomic status. And this will be like a linear aggregation, which you do in the linear regression. How do you do? In linear regression, there are multiple independent variables, and there are in multiple linear regression, and there is a single dependent variable. So this will be like a multiple linear regression equation when the x1, x2, and xn, they are the observed indicator that combine to form a construct. And you can see there is only one error here. Single error. You will not find many errors. There, the error was there with all the item. There we were forming the equation for each and every item. Here you can form a single equation like a multiple linear regression equation, and this error term will be at the level of the emergent variable. Okay, so Dr. Shamshad is asking me to give break. So, okay, should we take a break? 5 minutes break?
Yes, ma'am.
Okay, it is getting heavier. Okay. 5 o'clock. Dr. Suryanarayan, it will be there till 5. Tomorrow we are starting at 9:30. Okay. So we are here. Those of you who want to go for for 2 minutes or maybe relax a little bit. In between, if you people want to ask something, what you people are doing or any other query, then we are here to answer. Okay. So Dr. Nitin is saying with every slide, the concept is getting more clear. It's true. That's why we are going slow, Dr. Nitin. And by the end of this presentation, and maybe I shall definitely say that by the end of this workshop, you will be able to understand what is a reflective scale, why you should not perform a reliability and validity study on formative scale, and why we talk of this reflective model in case of the scale development and validation process. Yes, so these
Ma'am, in a scale, if we are going to develop a scale, so there needs to be only one type, like only reflective model and formative model, or some constructs can be on theoretical and some a theoretical construct. Like
generally, it depends. Generally, scale term we use for the reflective model. Or validation and reliability studies, we call it for the reflective type of state, where you are measuring the theoretical construct, the abstract construct. Like you told her regarding you are doing some project. So can you tell me what you are trying to measure? Okay. So
Ma'am,
Dr.
it's like an literacy scale,
Health
one type of
literacy.
health literacy into a specific area.
Okay.
So there it will be mostly reflective model.
Yes. Health
Uh,
literacy
I
is reflected.
Yeah, it will be totally a reflective model. I had a question regarding in our thesis, the students, they develop different type of questionnaires.
Okay.
They have some social questionnaire, demographic questionnaire, then some anthropometric measurement, then goes to clinical. Those anthropometric and clinical, they are mostly a theoretical because they are measuring those things.
Yes. True.
So while we combine the whole questionnaire, it will be a mix of both.
Yeah, but if you
So how do we validate that questionnaire?
no, the validation of that questionnaire is that term validation which you use for those type of questionnaire, that is only related to the pilot testing, like and the pre-testing, whether the items and responses, those responses are not of the theoretical construct. So validation term per se we use for the reflective type. There we write that yes, you will validate the questionnaire, but that we mean only the literal meaning of validation. That statistical the statistical validation is not there. Here, whenever you talk about such scale, there is a statistical meaning of validation, where you see the content validity, the convergent and discriminant validity, and construct validity and criterion validity, a lot of validity. So here we talk of a validity which is a statistical validity. There you talk of validity in general understanding, like checking whether the items they have formed, the responses, like whatever the score which they have given, like 1, 2, 3, 4, is it uniform or not for all the questions, the clinical symptoms which they have taken, is it representative of all the symptoms which are there in the textbook or maybe in some standard questionnaire, or because you write the semi-structured. So semi-structured means there are few things which are structured and there are few items which will be unstructured. So what about unstructured? What you are going to do with those unstructured items? And the questionnaire which they have, the PGs they have written, like, is it they have taken main times what they do? They convert the category. One of my student, what he did, we did not check earlier. So he took all the continuous variable as a categorical variable. Like BMI, he has calculated and then written. So I was not having a BMI as a continuous measure. So those things you see in the questionnaire, that type of questionnaire. So regarding the continuous variable and the categorical variable, they should collect the data with the inherent nature of the variable. They should not categorize it on the questionnaire. So how they are collecting the data, the variable which they have formed, how the data looks like. That validation is more of in that sense. That is not the validation which we will learn here. Is it okay?
Yes, ma'am.
Okay. So Dr. Om Prakash is asking, can you give example of an error in the formative model? Say SES. Yes, if you measure something, you cannot measure 100% socioeconomic status. Still, there will be some error. Any measurement, if you recall the linear regression, any model which you predict based on the independent variable, there will be some error. That you call it as a residual, isn't it? The model which you predict and the actual status. There is a difference between the two and you call it as a residual. So that error will be there. So error, yes, it can be there. Like even if that's why you say now that Uday Parikh, it can be one study. I think we were planning to have a study using 3 scales on one person and seeing. So if you only use Mahajan and Gupta, which is based on socioeconomic status, you might get a high this thing of that person. But if you use some other Uday Parikh in rural area, you will see that income is not there, but all those possession is there. So then you will classify that person as having high socioeconomic status. So there is an error term with the various scales also, or the indices. Are you getting, Dr. Om Prakash?
Yes, ma'am, but my question is the definition, what it was given there, like the error term, accounting for any variance in the construct not explained by the indicators. How are we going to find that? I mean, that's the point I was trying to ask. So how come we'll know something which we don't know actually? The residue comes because we don't know that factor is there or not. That's why we are not accounting it. Hope you understand my doubt, ma'am.
So you are saying that we are how to measure the error at this level. Let me see. At this level, probably. You want to ask how to measure this zeta? This one?
Yes, ma'am. See, zeta, I don't know what zeta is because I have missed it. That's why I'm not accounting it in that item. So,
So
like,
you will see this when we perform the PCA, principal component analysis. There it will give the value of zeta. Like error term, you will get there also.
okay.
That I will demonstrate this also. You will get, because this composite indicator which you make, like there was one person here from the ENT who will here also in our institute, we got a proposal from ENT. They wanted to develop some emergent variable on the assessing the turbinate hypertrophy or maybe some clinical symptoms. So they were clubbing 3-4 clinical symptoms and they were making one emergent variable. So that in that case, you will perform a principal component and maybe we will see how to define the error in that particular context.
Okay. Okay.
So now if everyone is back, I hope everyone is back. So this is again, we were like this factor is a dependent variable and these x1, x2, x3 and xn, the various items, they are the items, the observed variable, and this is the linear equation. So this is just a informative construct. The item between the relationship between the item and factor is like a multiple linear regression. So what will be the equation for a formative construct? It will be like socioeconomic status, beta 1 multiplied by income level, beta 2 wealth, beta 3 employment, and so on. And this socioeconomic status is the formative construct, and the error term will be at the last. So this will be the equation for the formative construct. So now let's understand the concept of variance. I told you that this whole calculation of the factor analysis and reliability and validity studies is dependent on the variance, how you are calculating the variance. So many of you know the concept of variance, but for rest of you, we would like to repeat this concept. What is a variance? Variance of a score or variance of item. So now, if I ask this question, you please rate your daily mood ratings. So let's say one individual rates his mood on a scale of 1 to 10 over 7 days. So on Monday, he has given the scale like score of 6. On Tuesday, 8, Wednesday, 4, Thursday, 7, Friday, 9, Saturday, 9. So what is your answer? Is there any variation in individual mood? Like you were saying now, one participant has asked, like answering the question depends on the mood of the person also. Yes. So if you ask the mood and there's a like the person is giving these numbers to the mood, is there any variation in the mood across the different days over the week? Yes. Yes, you are right. There is. So now, if I want to quantify this, how will I do that? So what I did, I just calculated the mean. Mean is the most simple. I just want to see the variation. So what I did, I just calculated the average. So the average comes as 6.29. But now what I will do, I will see the difference of this mean from the individual score. So what I'll do, I will see what is the difference, how much far they are from the mean. So I have subtracted 6.29 from each of the score, and this was the value. Okay, because variance is what? How much I vary from the mean. There's a data. How much my score is different from the mean score. But this was the difference. But if you add all these, what will happen? It will come to 0. That's why there was a concept of variance. Variance is what? You square it, basically. So what you do, so even though the mood rating, this vary from day to day, the sum of these differences adds up to 0. Why this happened? Because you can see there are positive and there are negative. And that's why there's a concept of, those of you who are in community medicine, you can recall the concept of standard deviation and variance. So what is a standard deviation? You sum all these deviations, you square it and you take an under root. That is standard deviation. But only the square, if you just keep only the square, this is the variance. So if you square, these are the difference from the mean. So if you see this, here these were the variables, these were the score, difference from the mean. So I have squared all these and I have added this. So what is the variance of this mood in all these 6 days? So answer will be 19.42. Have you understood what is this variance? Variance is basically we call it as a sum of square. Okay, so sum of squared difference is the variance, which you can see with this example. Have you understood up till this point what is a variance? So what is a variance? Individual distance from the mean. When you square and add it, sum of square difference is known as the variance. Right? Now, let's see another example. So variance basically measures how much individual data point differ from the mean of the data set. Okay, that's the basic definition of variance. So now can you tell the value of variance of mood in this table? Dr. Rupesh is writing 0. Saurabh is writing 0. Why it is 0? Because the mean is 6 and there is no deviation from the mean. So the variation will be 0. Yes, true. So this was the concept of variance, and we will use this concept when we will go to the exploratory factor analysis and when we see the confirmatory factor analysis. So this is the variance. Now coming to the steps in the scale development and scale validation. So till now, you have just learned the types. So what we did, we have seen the theoretical and atheoretical construct. We have seen that there is a broad construct and there can be sub-component of those construct. We have seen the 2 types of model, the reflective model, where the items are getting affected by the common construct and the error term is unique to it. And we have seen regarding the formative model, where the items are affecting the construct and the error term is associated with the construct. That is known as the formative model. And we have seen what is the equation of this reflective and formative model. So in the reflective model, we make equation for each item because error term is there with each item. And for formative model, we make a equation like a multiple linear regression where the dependent variable is the construct and independent variable are the all other item. Whereas in reflective model, it's the opposite. The independent variable is the item per se, which is getting affected by the construct. So the construct is a independent variable in case of a reflective scale. So if you see the various steps in the scale development, so you need to measure something. Let's say you are trying to measure, like the one person, that girl was saying that she's measuring the health literacy. So that is the construct for her to measure. And then you see that whether, then what you do, you see that any already existing scale is there or not. So if there is already standardized questionnaire and it is there in the public domain, because we will discuss the questions of those issues of ethical this thing, because many of the scales are paid and you don't get access to them. So in that case, what you should do then? So if you don't have access to those scales and if your construct is a new one, then you can think of developing a new scale. So what is the first step? So the first step is you have to identify the construct of interest. Like in this case, the health literacy that girl has said, or maybe those of you who are planning to have some study or who have measured something, All of you, please write what was the construct of interest in your case. Yes? Smart, okay. Ayushi, yes, you were there in that nomophobia. Dr. Shamshad was recalling every time this nomophobia, what went good and what could be modified. Yes, health-seeking behavior, well-being, attitude, burnt out, bullying, and victimization. Yes, so these are the construct, true. So now the first step is you have to first search for the validated scale. So all of you who have just written the construct, please go to the Google, open Google and type the construct of your interest. You type scale to measure underscore and like bullying and see if something comes out or not. All of you, Dr. Shruti has written attitude, maybe you can write attitude towards something. Burnout, where, in which, maybe as general burnout also you can see. So you have to define your construct and all of you please do this activity. You have to search for a validated scale. First, there are various other sites also like PsycInfo and other, you know that Sinahal and other database also where you go search for these scales. But right now only do it in Google. So scale to measure. Did you get any scale? Aditi is writing much less burned out inventory. Yes. So you will see now that whenever you have some construct already, there is some skill or some related scale is there. Like there was one girl who wanted to measure stigma. So stigma, yes, there was a scale which measured stigma in the HIV people. Then you can use that scale or modify a little bit to see stigma in some other disorder, maybe tuberculosis or maybe COVID. So even if your scale is there for some other disease, you can use that scale. But again, we'll learn those what to do, what are the initial steps before we use the existing scale. So Dr. Selva Raju, the gender equity scale is a 29-item measure of the individual perception of gender equity. Yes. So again, but you have to see. So is it an inventory, a scale, or index? So that we have to see because it's the individual perception. I don't know. You have to see the scale, whether that scale is a type of emergent variable or it is a measuring construct. That you will come to know. If you see the development of that scale, they write everything. That scale is a, it's a on a reflective scale or on a formative scale. Dr. Mahendra is writing some scales that can be used to measure health-seeking behavior. Yes, online health-seeking behavior scale. 2, malware salvo for emotional intelligence. But you will see all these scales are like, they are developed by the foreign authors. Very few scales you will see which got developed maybe here in India. And I'll just say if you are developing a scale, get it, the copyright issue is there. So just get, like these days you will see a lot of patenting and people are like filing their patent. So if you are planning to develop something of your own, you first get that idea patent and then you start working on it. So yes, you are right that you will get some scale. Gaming addiction scale for gaming disorder. True. That is again a very, these days, again a new problem has come up regarding the gaming addiction. So practically, you will see that you name a construct and you will find a scale to measure every construct on the internet. It might be a free or it might be a paid one. And maybe it is there on some other language, or you have to maybe translate it into your own language. That thing can be there. But if you require developing a new scale, so it is a tedious task. Most of the time it is a PhD topic, which requires 2 to 3 years of time. And it is theoretically challenging because it needs effort of a lot of experts and people. So you can also develop your own scale, but it is a resource intensive and time consuming process. So you cannot develop a scale in 1 month or maybe even in 6 months, you cannot. It takes more than a year, sometimes 2 years to develop a scale. So Morenski scale for drug adherence. It is an example of which type of scale? It is regarding the compliance. So yes, it is again, compliance is the issue of, it is a construct. So it is considered as an example. Example of what? Akash? Okay. I think he will make himself more clear. I'm not getting his question. Then again, the next is like, can we go through the literature review? Yes, definitely. That's the first process you do before you think of developing a scale. You have to do the literature review because you have to justify the need of a new scale. That's how you do in case of other studies also. Like what is the what you are adding to the literature if you are developing a scale. If already there is a scale and that is in the free domain, maybe you can write that scale is there, but not in your group, or maybe the construct which you define that is different from what they have defined. So you have to justify the need of developing a new scale. So first, we will tell you the if there is already existing scale, and if you want, because already existing scales are in English, and if you are interviewing patients, generally are the subjects or the study unit is the patients or medical students. So if it is in the medical students or if it is in the patients, then you need to translate it into the local language. So we'll see how to do that, because translation is again, it is a process which needs to be followed in a stepwise manner. So a validated scale is there, and let's, for example, we think that it is there in the public domain, and we can use it just after informing the author. And if it is there in our native language, then again, like PHQ-9, it is there in the Hindi also, and in many language it got translated. Then you can directly start with the reliability studies and the validity study in your population. You don't need to you don't need to form items, you don't need to change it. But again, after in that native language also, if the native language is different, what you speak, but because there are many dialect also of that native language. So if such issue is there, then again you have to modify the items. So the translation of the scale, this is an iterative process. And for that, what you do, the first step for the translation also, you have to establish an expert committee. Here we have written expert committee, but again, minimum of 3 people are required for this. One is the subject expert, another is a psychologist or a sociologist, depending on the type of scale. And you need 2 people to do the translation, one for the forward translation and other person for the backward translation. So at least 4 people are required in that expert committee. And the people whom you select, they should have a bilingual capacity. They should have a language proficiency. That's a very important criteria which they should have. Next step is your forward translation, which you people did. So we divided. Can you recall the group activity which you people did? I will just show you the result of that activity. So there is a one person who is a language expert. We usually give the English part to him and we ask him to do the forward translation. So he does the forward translation from English to the local language. And then there's another person who does the back translation, means from the local language to English. And then you compare both the original version and the translated version together. So you sit together, all the 4 people, and then decide what should be the format and how the translated version should be. It should not be done only by the single person, because then you will not be able to take the decision. So let's see the translation activity. So I'll just show you the Google Sheet. So can you all see this?
Yeah.
This we have, yes, that's why I'm showing it to them. this activity you people already did. So this you can see that this was the question. When a friend start to talk about his or her problem, this was one question which we took from the empathy scale, Toronto empathy scale. And the question is, when a friend start to talk about his or her problem, I try to steer the conversation towards something else. So this was the translation which we received. You can see that there are some local, like this is Bangla, Paramita has done. I cannot read this. Sukalyan has again done in Bangla. This is Bhavna has done it in Hindi. जब कोई दोस्त अपनी परेशानी बताना शुरू करता है या करती है, तब मैं उस बातचीत को किसी और दिशा में लाने की कोशिश करता हूँ या करती हूँ. ठीक है, this was one Hindi. I can only understand Hindi. I am sorry. Again, Amiya has done. जब एक मित्र अपनी परेशानियों के बारे में बातचीत करना शुरू करता है, तो मैं वार्तालाप. So he has used the term. If you see this, he has used this term, vartalap, this one, in the local. But I don't know whether if you say this vartalap, the people will understand or not. I have no idea. Maybe it is again, you have to use the words which are used locally. Like baatcheet, many people have used baatcheet. Again, he has written, there's another person, Aditi has also written this vartalap, if you can see. Again, रुद्रेश has written, जब कोई मित्र, तो मैं बातचीत को किसी और दिशा में मोड़ने की कोशिश करता हूँ. Again, maybe a very local term, you can see. Then again, Priyanka has also written मोड़ने. Nitesh has written, मैं बातचीत को किसी और चीज की ओर ले जाने की कोशिश. See, he has written cheese. And then Latika has written, बातचीत को he has also written चीज की ओर ले जाने का. If you see Anuradha, she has also written किसी चीज की ओर ले जाने का. So if you see this, so you have got these many translation. Again, these are from the other this thing, so I cannot read. We will see in the back translation. So this was one activity. Now we received the response of the other group who did the back to Hindi. No, this was the, and there was another question. When I see someone being taken advantage of, I feel kind of protective towards him or her. So this was given to another group B. So this, you can see these questions, how they have done it. So just Richa has written, जब मैं किसी व्यक्ति को किसी अन्य व्यक्ति का फायदा उठाते देखती हूँ, तो मैं उसके प्रति अपनी जिम्मेदारी. So like she has written जिम्मेदारी. If you see these words, I'll just because if you see the individual question, it is very different from one person to another. Kajal has written सुरक्षात्मक महसूस करती हूँ. Now again, you need to understand, मैं उसके प्रति सुरक्षात्मक महसूस करती हूँ, if the person who is attempting this will be able to understand or not. Again, Rupesh has written, मैं किसी निर्दोष का फायदा उठाते देखता हूँ. So here he has written निर्दोष. So this word is added again now. And मुझे उसको बचाने का मन करता है. See, so there is a difference. Again, रक्षात्मक, somebody has written रक्षात्मक. So I don't know whether rakshatmak will be understood in the local context. If you give this to a medical student, means medical student, definitely they will understand in English. But like if you want to measure empathy in some other person in Hindi or in local language, then I don't know how much this rakshatmak may be. Depends. That's why I said that local person who knows the local language well. How do people, because there are local dialects, local words, and I'll share, I think if time permits, Dr. Supriya, who is again doing one study on the antenatal depression, she has done this in the community, understanding the local, how do they perceive a particular word or understand. Maybe she might share it tomorrow, because today I think less time is there. So these you can see. अगर this is Ajay Kumar has written, जब मुझे लगता है कि किसी का फायदा उठाया जा रहा है, तो मुझे लगता है मुझे उससे इससे बचाना चाहिए. Again you can see this he has written. And Dr. Mahendra has also written, again मैं किसी एक ऐसे व्यक्ति को देखती हूँ जिसका फायदा उठाया जा रहा होता है तो उसके लिए थोड़ा रक्षात्मक महसूस करती हूँ. So again, you can see the various responses. Now, this you have just done with the 2 questions. If you see the backward translation, so this was the backward translation for this question. When a friend, this was the original item, this one. When a friend tries to, starts to talk about his or her problem, I try to steer the conversation towards something else. So this was the back translation. When any friend start talking to his problem, then I try to divert the discussion to some other direction. So there is a difference between steer and divert. So you have to see the words. So original was a steer. Divert means you are deviating, and steer is to take control. Steering, we what say, like taking control of. So similarly, you can see I change the topic and talk about other things. Then again, I try to steer. Here, I think I don't know the person. So up to you to decide about, but you can just see, deviate the topic, the forward and the backward translation. And then you sit together. So all 4 people, the expert, the 2 language expert, and the researcher, you all 4 sit together and just discuss this issue, what a particular format of this translation you should accept. Similarly, you can see this was the back translation. When I see someone being taken advantage of, I feel kind of protective. So whenever I see an innocent person being used, I feel like protecting him or her. But another person, when I see someone taking benefit of a person, I urge to protect that person. So all is right. You just have to see, every word will not be same. But if the meaning is same, then you can keep that in the translation. So ultimate, it is the language expert who are bilingual expert. They will guide you. When both sit together, they will guide you. And many times what we did practically, like in case of Supriya, this thing, she took help of her friends, because in Bihar, many times it was difficult for us to find a language expert, a bilingual one. And maybe it depends, because if you ask someone to do some work, they'll ask for some remuneration also. So if your activity is like a PG thesis, you can take help from your friends, and they can also do this. Like many people, they are expert in both the language, who speak the native language and they know English well. So they can act again as a language expert also. So yes, Shruti is asking, language expert are different for forward. Yes, they are different. So that's why I said there will be 2 experts. The person who is doing the forward translation, he will be the different one. Ideally, you should have 2 experts, 2 in each team. 2 for the forward translation and 2 for the backward translation. That should be there when you have funds available, and you can give like give some remuneration to them. But if you don't have such fund available with you, and you have to do like a simple research of a senior resident or a PG, then at least you can use this process. You can keep separate person for the forward and backward translation, and the 4 of you can sit together and decide regarding the meaning of that translated item, and then you can keep those items. So language experts are available in institute. So Venkatesh is writing, okay, that's good. If it is there, then you can talk to those people. Again, there's one question, backward translation is directly from English to English. So backward translation is from the local language to English. Local language means like, no, see, the scale is in English. And if you want to translate it in, let's say, Tamil. So you will first get it translated from English to Tamil, and the other person who is the back translator, he will translate it from Tamil to English. And then you will see if it is, yes, whatever, if the scale is in Spanish, then you have to do first Spanish to probably, then you have to take a longer route. You should hire a person who knows these both Spanish and the local language. Then you have to like do it like that. So you should be having an expert who should know both the language of the original scale and the language in which you want to get it translated. Like in our case, mostly it is English, because in Bihar, we speak English and Hindi. I mean, we as a this thing speak English, but the general people, but the Hindi is not the Hindi which you will find in the Hindi translated scale. The Hindi is like the words which you have used here, like Vartalap, Surakshatmak, those terms they will not understand if they will read it. So the person should be knowing both the language. Language means not only the Hindi, the local dialect also. Because Hindi per se is also like it varies from place to place. The Hindi of UP, Uttar Pradesh and Hindi of Bihar and Hindi of Madhya Pradesh is different. You cannot have the same local context everywhere. Okay. Dr. Seethal has raised her hand.
Ma'am, if you are, we are we PG students are going to the field and asking them in our local language, asking the question, not giving them the question them to fill up. So there, do we need to have a written translation, translated sheet, or we can use the English version only?
No, no, no. Why? Because while administering also, the student will add something from her or his end. That's why you should, otherwise the data which you will collect now, there will be issue of reliability. So even if the student is asking, you should have the Hindi translation or the maybe Odia, if it is from Orissa, Odia translation, so that the student should read the same sentence to each. Otherwise, there will be intra-observer bias. One observer will ask one question from one person in some other way because he is also changing every day, right? With repeated asking, he might start asking question in some other format. So that thing is there even in case of a qualitative interview also, which is very much open. We always advise that you should ask question, you should have a format. Maybe while asking, while clarifying, you can add something. But initial question, it should be asked in the similar way to each of the participants. So we never encourage taking the English version and then asking the questions there in the field. Especially here, why? Because there is a problem here also because people are coming from different background. Like people are here from the Karnataka, from Andhra Pradesh. So their English and their local, this thing is also very different. So we always encourage to have a local translation, go with the translated. And there also there is one advantage. If you find someone who's literate, who's understandable, you can give it as a self-administered because ideally this should be a self-administered. But since there is issue of illiteracy, everyone is not that literate, not able to understand. So we also say many times that collect the responses. But it's a time-taking process, collecting the responses. Did you get it?
Yes, ma'am.
And that's how you will see here. So in ethical committee and research committee, it is mandatory that you should submit the local form of the questionnaire. Even if like you are going to fill the responses. Because there will be then biases in asking the questions. Because, you know, every single meaning, every single word has got different meaning. If you read these questions. Okay, so yes, going forward. So have you understood this, the translation process? So again, to reiterate, the two language experts should be different. One for the forward, ideally two for the forward translation and two for the backward. But if there is a resource limitation, you can have one for the forward and one for the backward translation. And then the four of them should sit together and decide like which, how, I mean, is it, they should match the backward translation and the original version of the scale and then see. So these were the two questions. So now coming to pilot testing, no. So content validity, we are not telling now. Okay, so after this, after you have developed this scale, means develop the item, here though you are not developing at all. Here just you have did the translation activity. So you have translated that into your local language, and then you have to see the pilot testing. So pilot testing is you do this in 30 to 50 participants, And the purpose is that you just check for the validity, the reliability. The scale which you have tested, I mean, which you have translated, what is the reliability of that particular scale? So you check for the content validity of the scale, and you check for the internal consistency of the scale, which is through the Cronbach alpha. So these two processes you should undergo after the translation activity. And finally, you have got the version 1 of the translated scale to measure the construct of your interest. And this is again, you can publish this as such. Only the translation, you will see many articles. I think one participant, she translated one scale. So you can also publish it only as a translation part. How? But in that, the process should be very rigorous. You should use with a good study procedure, you can publish that. But again, if you don't find any questionnaire to measure your construct, then you go for the paid. Paid again, there is an issue that the charges are high. So if the institute can pay, or if there are any mechanism in your institute to pay for that, you can pay and you can use that. But if you can write a mail to them that you are going to use it for academic purpose. So many times you will see that they permit it for the use of academic purpose, maybe for the high stake use, like for marketing or for maybe diagnosing and taking decision making, they deny the use of their scale. But for academic purpose, many times they give also, and many times they refuse also. So then you don't have any choice rather than to develop your own scale. So in that case, we'll just tell you, and in that case, you have to justify the need for your new measure. And these are the steps in the scale development. So if like you don't find any scale, or if it is a paid version, you cannot pay for it, you ask for the permission, the author denied for the permission, but you want to measure a particular construct, in that case, you will start with the process of scale development. So scale development is the first step. If you come to the first step, it is the development of a expert committee, because a scale cannot, first you will see that after who should be there in your expert committee, because you have to identify the construct of the scale, the operational definition. For that, you should have expert committee. Expert committee should have a behavioral science expert, a psychologist, a subject expert, a language expert. So it is a team of 4-5 people. And you have got some representation from the patient side also, because patients are again one stakeholder. So you can select maybe during the later part, they also form as where you have to consult them. And then the next, so the first step, if you see, you have to identify the construct. So let's say I want to measure this empathy, and I don't find any scale of this empathy. And if there is a scale, I wrote to the author and he denied that I can't even use it for the academic purpose. And even if you say there are items, so items are their copyright. So you cannot take items also for your use. Even if you take some idea from the item, only the citation will not help. You have to take permission, and that should be a written permission. You should have a written permission from them. So recently we experienced one episode, one of our students, he did adherence measurement in hypertensive patients using Morinsky scale. So Morinsky, you will see that it is in the open public domain. I mean, he did not thought of it, and he sent the article for publication. So once that was out in the public domain, that person who is the owner of that Morinsky, maybe the son of that person, Morinsky developed, then now his son is looking after that scale. So he sent a mail to us that you have to pay for, I think, how many dollars, I don't know, 10 lakh rupees. Okay, so you have to pay 10 lakhs rupees for the use of that scale. Since he did not take the prior permission. Many times PGs think that, we can use it. It's there in the, questions, we can take it from the internet. Okay. So Dr. Shamshad is saying that he tried, but the many times you will see the email ID that did not went to the actual person. So he did not take permission, and then he was asking for money. So ultimately our PG has to retract the article. We wrote to the journal that we want to take back the article because of this copyright issue of the scale, and then we did not publish that. So Dr. Rupesh is writing, sometimes many items in some one scale are not applicable to the local public. We need to change it. Can it be done? Yes, if definitely it can be done, but again, it will be like if you are adding something or changing something, then you need to do again the reliability and validity studies. So it will be like a new scale. Even if you add 1 or 2 items, it will be like a new scale. So minor change means like if you're not adding, see, adding of an item is like a change, or deleting an item is like a change. Like we did 2 scale validation, this thing for the statistical anxiety. So my construct was measuring the statistical anxiety in the medical students. So that construct, we deleted many items of our existing scale. So then it was like a new scale. So we had to perform the reliability and validity studies on that scale. Okay. So you should conceptualize and operationalize your construct. So conceptualization is basically you define it as a theoretical this thing. Like what is the theory? So conceptualization, like in this case, maybe if there is a empathy, you have to define it. Like if you see this example, prejudice. So prejudice is a general concept or the general construct. It can be, you can define this prejudice into subdomains. Like if someone says bad things about a racial group, will be a racial prejudice. If a woman earns less than men for same job, it will be a gender prejudice. If a doctor believes that they are superior to nursing staff, this is a professional prejudice. So prejudice is again, it has got many contextual prejudice. So prejudice will be general. So any concept or any construct, it has got a general domain and there are contextual or specific domain attached to it. So construct, you need to get a definition of construct from the theory, from the literature review, and you need to give the mental idea or mental abstractions to a concrete level. That is the operationalization. First is you define it, but again, definition will not work and you have to give how you are going to measure it. So that is the operationalization. So conceptual definition only provides the platform for the operational definition, that we will going to take the data and we will empirically measure the construct. So let's say this empathy. So construct, again, it is represented by a wide range of variables. For example, happiness, you can see it could be associated with love, financial security. Somebody who's taking cigarette smoking, he will feel very happy, or playing with puppies, singing a song, having an ice cream, and so on. So translating construct into operational definition, this is an iterative process, and you need a subject expert, like I said, a sociologist, a behavioral science expert, to define the operational part of your construct. So now next is your coming to this. You have first step was establishment of expert committee. Second was you have to identify the operational definition and theoretical definition of construct, its dimensionality, and now coming to the questionnaire format. So what do you mean by questionnaire format? Like one participant said that she was taking it as an interview process. So will your scale will be a self-administered scale, or you will take the interview? That will decide how you form your questionnaire. So generally we form this scale in the form of a self-administered. But again, if you intend to develop it as in the form of an interview, then this selection of items will be different. And the fourth is you define the item format. What is the item format? Item format is basically whether you are going to take a 2 response like yes and no, or you will take in the form of a Likert scale. So we'll see the different items format. Okay, so Dr. Shamshad. Okay, so time is like less. So I am going to slide number 80. We'll see these concepts probably tomorrow. Okay. So this is one activity. So breakout room we have to announce. Okay, so we have to develop a new scale to test empathy of a person. So although we have got a well-established scale for empathy, but still just think that it is not, we did not get permission to use that scale, and we assume that no such scale exists. So you have to develop item, empathy of a person. Remember empathy. So now what will be my first step? I'll define empathy. So my theoretical definition of empathy is, this is the definition which I took from the Google. You will have to take a I mean, it is not so easy, but just for the workshop purpose, I have taken this definition, that the cognitive and emotional reaction of an individual to the observed experiences of the other. This is the theoretical. And if you see the operational definition, it was the capacity to think and feel oneself into the inner life of another person. This is the empathy. Okay, inner life. So you have to define the terms. Inner life, what are the item will be from for the inner life, and how you can think and feel. What do you mean by feel? So this is the operational definition. Now you have to define some items. You have to formulate items using this operational definition. This is operational. So all of you, please go to the breakout room. They know where Akash.
We have shared Google.
Yes, ma'am. I'm just
Wait for
opening
1
the
minute.
breakout room. Huh?
So instruction is like we have shared the Google form, this Google sheet. You have to write the item in the Google sheet. So where we have shared in the I think we have mailed it. Mailed it to you, and we have sent it over WhatsApp also. Okay. So yes, I think there is some disturbance at some end. So please open the room, and mentor, please just see that they are doing the activity on that Google sheet. Instruction is
Where is this Google form of empathy? Google form for empathy is where?
Akash, can you hear me?
इंस्ट्रक्शन दे दीजिएगा गूगल शीट शेयर्ड है उसको
Yes, ma'am. Yes, ma'am.
So there are a few participants who have not been assigned, and the screen share the rights has been given to all of you, and all the
Okay.
participants, they have to generate items for empathy on Google Sheet. Okay, Doctor, I think we have closed the breakout room. You again reopen it. Let all the participants come.
Okay, okay, ma'am. Like the breakout rooms are closing in 20 seconds
Yeah,
now.
yeah, yeah. You again reopen. After, I think I could not give the instructions well. So let me give the
Okay.
instructions once again. And then you open the breakout room again.
Okay, okay, ma'am. Okay. Hello, ma'am. The breakout rooms have been closed now.
Yeah, so I'm just waiting. So can you all hear me, all the participants? Yeah, yeah. So I could not give the instructions well. So basically, you all have to, in your respective group, you have to develop items on empathy. You have to type those items in the Google Sheet. The link of the Google Sheet is there in the WhatsApp group. It is there in this message group also of this meeting chat, and it has been shared to you over mail also. So any one of you, and we have given the sharing rights, screen sharing rights to each of you. So you people, any one of you can share the screen also, and then keep typing those items in a group, in your respective group. Okay. So are the instructions clear to all of you? Like one person take the lead of typing. Dr. Venkatesh has raised his hand. Yes, Dr. Venkatesh.
Ma'am, just to check my understanding, with the empathy as construct, we will be constructing 10 different items as a teamwork, and it will be entered in the sheet. It's not like each person should enter one item, right?
No, but like everyone will make the one person write on the Google Sheet. One person will be writing, and rest all will help in formulation of those items, and not necessarily the 10, maybe as many in the given time, maybe 5 till 5:15, for 15 minutes we will, or 10 minutes we will have this activity. But good is to devise your own item, something, whatever. Don't see the internet, because in the internet already there is a scale. But think of something which is coming to your mind whenever you see this term empathy. Okay.
Okay.
Because we have to see the content validity index on this item which you are doing. Because if already there is a content validity has already been done. So we want the items which you people generate that will show exactly the content validity when we send this to some other expert. Okay. So we want to check for the content validity of the item which you people are telling. Did you get the purpose of the activity?
Yes, ma'am. And it is not.
Like
See how that particular item is performing. And once you give that response, we will analyze and we'll see the content validity tomorrow, how to perform content validity. Again, the second is we will share one scale with you people. You have to send it to at least 5 medical student or medical person, 5 to 10, and ask their response over that. Is it okay?
Okay, ma'am.
And what you will do, which you have, the response which you will take, we will show you the reliability and the factor analysis on those collected data. Am I making myself clear? One sheet you will get regarding the content validity. Instructions will be there along with that sheet. You have to rate the particular item which you have generated. So we have got a list of 50 items approximately for this empathy, and you have to rate those items. First activity is this, and we will show you the content validity on that sheet tomorrow. The second is we will share one Google form with you, and you have to take response of at least 5 to 10 medical person, maybe students or any of your friends, and that data which you people have collected, we will show the reliability and validity studies on that data. And that's the actual process which you will have to carry out when you are going for either the translation or the use of an existing scale or developing a new scale or maybe revising an existing one. Are the instructions clear to all of you, or any ambiguity or any queries there? Then we can answer right now.
We have to, what do we have to do on the data, the compiled data sheet we will provide? We have to rate them on basis of what? How they
That
are.
instructions, that instructions you will get like relevant, not relevant at all. You will get that scoring of 0 to 3. That instructions will share. 0 is not relevant at all, somewhat relevant, very relevant to the existing construct. We will share the instructions with you over the WhatsApp.
Tomorrow, 8 o'clock.
So by tomorrow, 8 o'clock, I think. 8. By 8, try to do it. Is it okay?
Yes, ma'am.
Yes, ma'am. Thank you, ma'am.
Okay. So thank you, everyone. We'll start from where we left today, like Likert scale tomorrow. So if possible, you just, are we sharing the recording today?
Recording shared.
We will share the recording by 9:30. We'll try to share the recording so that if time I
Tomorrow, at what time is it?
we are planning 9:30, so that because tomorrow there are 2 activities like this content validity and reliability. So there will be 2 breakout rooms.
Okay.
So I think it will take approximately 3.5 hours. So
Okay.
we are working till 1 only on Saturday.
Okay. Okay.
Okay. Thank you, everyone. See you people tomorrow. Good day to all of you.
Thank you.